First of all, as a blanket statement, it's important to everybody understand the stay-at-home order, that this is not a competition to see what you can get away with, right? We rely on people complying with the law. It's not a time to figure out how close you can get to the line. It's a time for all of us in our individual lives to instead decide how few people can I interact with in the next few weeks? How can I limit the number of friends or acquaintances or strangers that I'm coming into contact with? That's the contest, folks, right? The contest is to say who can best comply with the spirit of this. Don't worry so much about the letter. Let's try to compete to figure out how all of us can stay away from more people to the extent we possibly can. And just to stay at home is the guidance unless it's absolutely necessary. It's also important that if you do go out, you keep your distance from others. You wash your hands frequently, properly, with soap, 20 seconds, wipe down surfaces, and use common sense, everybody, right? We need to use our best judgment to err on the side of your own safety and the safety of others.
You know, you got to assume it's everywhere. As Dr. Shah has said several times just this week, you've got to live your life as if you have it. Live your life as if it's here in your neighborhood, in your community, because it's just a matter of processing the test results and determining where it's confirmed. But it is everywhere. And when somebody decides to go to a store, make that decision thoughtfully, cautiously. Don't take your whole family. Don't go with a pile of friends. Don't pile in the SUV like you used to. Don't pile into a van to commute to work in a crowded van of 5, 10, 15 people. Stay away from other people, whether you're going to the store or going out for exercise or any other purpose, legitimate purpose. Stay away from other people.
It was exactly 3 weeks ago that I was at Danbury Hospital when we had our very first COVID-related infection. And now, 3 weeks later, we have 1,291 folks who have been infected. In this last day, we had 1,900 tests. You may say, I thought we were doing less tests. Slightly, but more to the point, a lot of results came in. A lot of results came in from the out-of-state labs. Of those 1,900 tests, 279 came back positive. Little interesting, that's a big number, the biggest number we've had, but the lowest percentage in a while. That's 15% of the total tests. We're still analyzing that data, but may reflect the fact that with more drive-through testing, some folks who are less severe were more likely to be tested. And 173 hospitalizations. And that's what I'd like to talk about a little bit today, because that's the beginning of the surge, the beginning of the folks going into the ICUs needing hospitalization. By the way, 27 fatalities now, all in 3 weeks.
Our numbers are climbing exponentially. We knew it was a matter of time, not if, COVID-19 would come to Michigan. We took aggressive measures. We've been on the front end of aggressive measures that states have been taking, but we see this astronomical rise. We've got hospitals that are already at capacity. We're running out of PPE as well. I'm grateful we got a shipment from FEMA yesterday for 112,095 masks, but you know, we're going to be in dire straits again in a matter of days. And so we are keeping up the pressure and working 24/7 at the state level, and grateful that there are people who are doing that at the federal level as well. But this is not something that we should be fighting each other on. It should be everyone fighting COVID-19, right. Everyone versus COVID-19.
Look, I think the virus is going to dictate the time frame, and we're going to follow the advice of the scientists and doctors like Dr. Inglesby, who you just had on a moment ago. He's on our task force. But no, we don't see any way that we're going to be opening back up in a couple of weeks. The Washington metropolitan area has, Maryland, D.C., and Virginia, quadrupled in the past week, and we see that continuing to grow exponentially. And we think in 2 weeks around Easter, we're going to be looking a lot more like New York.
We need to make decisions based on science and reality, and there are some hard realities we have to understand. And that is, unless we continue a very vigorous social distancing program in my state, this is going to continue to spread like wildfire to every single corner of my state. That is an inevitable scientific fact. And we have only one weapon to prevent that, and that is to continue our social distancing. We are seeing some very modest success in bending that curve just a little bit, but that's very unpredictable, and we have a long, long ways to go. I think it's highly probable that the 2-week stay home, stay healthy initiative that we started just a few days ago is going to have to be extended just because of the epidemiological evidence. And boy, I would not want to be responsible for opening the door to this virus to ravage our places that seem okay today, but within 10 weeks, within 10 days, can be at full scale burning through our hospital system. And we've seen this happen. We've got to be ahead of this curve.
Here's some encouraging news. Earlier this week, the federal government took historic steps to help us combat this pandemic at the state and local level with the passage of a $2 trillion emergency relief package. For starters, the federal stimulus is going to put a check into the bank account of eligible Kansans who, with adjusted gross incomes of up to $75,000, and eligible individuals between $75,000 and $99,000 would receive checks on a sliding scale basis. It's my understanding that those emergency cash payments will begin to materialize over the next few weeks. I know it's not going to be enough to cover the full economic blow of this crisis, but hopefully it can help cushion the sudden impact of lost wages, especially for those families living paycheck to paycheck. The federal bill will also add unprecedented reinforcement to Kansas's unemployment insurance program. More Kansans will be eligible for benefits, even gig workers and small business owners who did not previously qualify. Additionally, all Kansans eligible for unemployment will receive $600 more per week in benefits, more than double the current weekly benefit in Kansas of $398.
The $2 trillion package that Congress passed, that the president signed into law, we know is going to help with hospitals with unreimbursed expenses, the expansion of telehealth. We know that families are going to benefit, small businesses, employees.
Is it enough?
Nutrition for our schools and our food banks. Well, you know, it's a very generous package. It's the largest one in the history of our country.
Right, but is it enough for you?
There's about $1.8 billion for, well, there's $1.8 billion for the state that's going to help. And so there's going to be additional legislation coming forward, I believe, as well. But we know that this is a good start, and I appreciate everything that they have done in Congress in order to help us. And we're going to be working with our congressional delegation. If we can identify other needs that we can get help on, we're going to make sure that we continue to do that.
I thought I'd ask all of us to do a couple of things today. The first thing is, let's all try to do one kind thing today for somebody in our lives. Let's be honest with each other. We're all on edge. We're all tired. This is weird how we're living, and we have weeks ahead of us. So just try to find one thing you can do. A kind word, biting your tongue so you don't say a mean word, calling a neighbor, giving somebody a hand virtually, checking in on an elderly friend or neighbor, see if they need you to go to the grocery store for them, shooting a text to somebody. Just everybody today, try to do focus on doing one act of kindness so we can all get through this a little bit more easily. The second thing I'm asking you to do is today, it's the beginning of the week, write down the list of 4 or 5 people who you're going to limit your interactions to in the week ahead. I want you to write it down, because here's what we know about how this spreads. Yesterday, I ordered that social gatherings could only be 5 people or fewer. But we don't want you to be hanging out with a different 5 people every day. The whole name of the game here is reducing your number of contacts. If we're going to get a handle on this rate of spread, we have to reduce everybody's number of contacts so that if you are infected, you're in touch with fewer people. So everybody today, write down on a piece of paper, who are the 4 or 5 people that you're going to reduce your contacts to in the week ahead?